Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to all of our partner organizations who are involved in All for Knox. Yesterday was International Overdose Awareness Day, and we are grateful for the folks in our community who are working diligently to address the issue of substance misuse in our community. Our real-life example of putting the 5 core actions into play is going to a wedding. Weddings are times of celebration and can be incredibly special events that you don't want to miss. In these instances, there are things you can do to keep yourself and others safe while still celebrating with a happy couple. First, if you aren't feeling well or have been exposed to someone with COVID-19, please stay home. If you are attending, when you arrive to the venue, keep it at least 6 feet from people who don't live in your household. There will likely be areas where it's hard to keep this distance. In these places, make sure you are wearing your mask. When choosing your seats, be strategic about it. Choose a place where you can be properly physically distanced from anyone who doesn't live in your house. This may mean sitting in the back or on the side. If you are attending the reception, the same guidance applies. Remember to wash your hands before eating and after you touch any common surfaces like hand railings or door handles. These are just a few simple tips that will help keep you safe while also making it possible to enjoy a special occasion. This week, we are testing at the Jacob Building in Chehawood Park, today through Friday from 9 a.m. to 3 p.m. As a reminder, the Board of Health will meet via Zoom on Wednesday at 5 p.m. For those who interested in registering for public forum, you may call the mayor's office today between 1 and 5 p.m. Now we'll move on to the local situation. We have 91 new confirmed cases since yesterday's report, giving us 6,642 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 235 probable cases. 4,502 of our cases have recovered, giving us 2,316 active cases. 266 individuals have been hospitalized at some point in their illness. Currently, 45 Knox County residents are hospitalized. Fortunately, we have no additional deaths related to COVID-19, keeping our total at 58. I'd like to spend a few minutes now discussing death counts as it relates to COVID-19. There has been a lot of chatter about this, so we want to spend a few minutes talking about this topic. First, cause of death in any situation is determined by a medical provider or sometimes the medical examiner. Comorbidities or pre-existing conditions are conditions that people experience along with the primary condition. It has been stated many times throughout this pandemic that the elderly and people with some pre-existing conditions are at high risk of complications and death due to COVID. Some of those underlying conditions include obesity, cancer, diabetes, among others, all of which are unfortunately not uncommon in this country. The data that the people are referring to from the CDC report goes along with the statement. The majority of deaths related to COVID-19 are occurring in people who have comorbidities and therefore are at higher risk. On a death certificate, these comorbidities could be listed alongside COVID-19. This means that COVID-19 was a contributing factor to the deaths. It does not take away from the impact of COVID-19, as the virus exacerbates any pre-existing condition, therefore making it harder for the body to recover. It's also important to note that COVID-19 can cause additional conditions that contribute to death. For example, similar to the flu, the presence of this virus in the body can lead to respiratory failure. If someone were to die, respiratory failure would also be listed on the death certificate, as well as COVID-19. The individual may have died from respiratory failure, but it was COVID-19 that was the underlying cause of the death. In Tennessee, the state medical examiner's office reviews all possible COVID-associated deaths. Deaths are only counted as COVID-19 related if the virus is found to be a significant contributing factor to the death. If someone tests positive, but then sadly dies in an accident, completely unrelated to COVID-19, they would not be counted in the death count for COVID-19. We know this can be confusing, but the bottom line is people are dying from this virus, either directly or as a significant contributing factor. Those with pre-existing conditions may be more susceptible to complications and have several conditions listed on a death certificate. That does not take away from the fact that if they didn't contract COVID-19, they likely would still be here today. Now I'll open it for questions.
All right, the first question we have is from Brian Hornback. Essential employees, if teachers are classified as essential, is it true that they do not quarantine if in close contact with a positive test and are not exhibiting symptoms?
So first of all, in the state of Tennessee and actually nationwide, teachers are not, at least here, not considered essential. That's a tough word. So just to get that off the table, yeah, there's an allowance for teachers to be determined to be essential to process that the schools go through. To our knowledge, Knox County Schools does not plan to do that. But it is true if someone is a asymptomatic contact to a case and they're an essential worker like a nurse or an EMT or somebody like that, they can work. If they're asymptomatic, they have to wear a mask the whole time, and they can only go to work and go home. So they're still in quarantine. They're just working while in quarantine. If they develop symptoms, they're immediately sent home. So that is an allowance. And the reason that allowance was put in place was to keep staffing up, so that if in a hospital or emergency responders need to be on the job, and if staffing were low, they would need to allow those people to work while they're in quarantine.
From Daniel with WBIR, we are hearing KCHD switched COVID-19 lab providers again last month. Why the change? And has the department seen a change in turnaround time?
We did switch lab providers, and yes, we have seen a turnaround time. Right. So I think it was, let's see, this is now September. Yeah. So yes, we did switch last month. So sorry about that. And so yes, we have seen an improvement in our turnaround time. It's about 48 hours now or less for us to get our labs back. We're using a couple different labs. And the reason for that change was turnaround time and also ease of use for our staff and interface with our EHR and other things that just make it easier for our staff to work with those labs.
Also from Daniel at WBIR, Labor Day is next week. What is your guidance for people wanting to get together with family or friends?
5 core actions. You need to practice the 5 core actions. The virus does not take a holiday. It does not celebrate Labor Day. It is still in our community and will still be able to be passed even if you're having a barbecue with people you know. So remember to practice the 5 core actions. There are lots of things you can do to improve safety. You know, if you're having families over, put them out, try to be outside and put the families together. So the family units or household units are more than 6 feet apart. You know, keep things outside, have masks available for your guests, lots of hand sanitizer. The 5 core actions must be practiced for all the time, but especially over the holidays, we kind of get happy and forget what we need to be doing, and don't let your guard down just because it's a holiday. I think we have some data that we're looking at related to holidays and how we've seen an increase in cases after holidays here in Knox County.
From Isabel with Knox News, if someone tests positive for COVID-19 in the classroom, is everyone in the class determined to be a close contact and required to quarantine?
No, deciding who to quarantine can be complicated. So remember, close contact is defined as less than 6 feet apart for more than 10 minutes. So it depends on the type of class, what the class activities are doing. And that one of the reasons we've asked the schools to keep seating charts so we know who's closest to that student or that teacher who tested positive. So it can be complicated, working very closely with the schools to minimize disruption while at the same time keeping everybody safe.
From Jeff with WATE, did the move away from the Jacob building and then back impact the response to testing?
So you mean like people getting tested?
Jeff, if you want to clarify what you mean by
By
response
response.
to testing, we can further answer that question. From David with WVLT, this week marks 6 months that we have been in the battle against COVID-19. What is it going to look like in another 6 months?
Wow, it's a great question. So many things. What it looks like in 6 months depends on so many different things. It depends on whether we have a vaccine. If we have a vaccine, it'll probably look a little bit different. It won't look a whole lot different. I think we'll still be recommending social distancing and hand washing and masks and things going forward, because we won't be able to get everybody vaccinated immediately. And we need to get a certain number of people vaccinated to have what's called herd immunity, where people have some immunity to the disease. And it's very likely, because this is a brand new vaccine, just like the first time you get your flu shot, lots of folks are probably going to have 2 doses. So that's going to take some time to get that done as well. So I think it'll look different if we have vaccine. If we don't have vaccine, it's going to look like it looks now.
Jeff clarified his previous question, and he meant, did fewer people take advantage of testing?
I don't have the testing numbers in my head, so we can get back to you on that.
From Daniel with WBIR, you mentioned data from previous holidays. Any examples? And do you anticipate a different level of caution from people who gathered this weekend versus, say, July 4th?
Stay tuned. We'll have that data, I believe, on, I'm looking at my staff, tomorrow or Thursday. So stay tuned, more to come.
From Isabel with Knox News, what is the determining factor for why a person in a classroom would not need to quarantine?
So whether they meet the definition of a close contact or not, that's how we decide. In a classroom, in a workspace, at a house, wherever we are, wherever we have a case, you use that same definition within less than 6 feet apart for more than 10 minutes.
And her follow-up question was, how does a contact tracer determine if someone has been within 6 feet for more than 10 minutes with an infected individual?
That's why our interviews take a while to get done, because we ask that individual to go through 48 hours of time before they got sick. And sometimes that can be a few days away in the past. So we ask 48 hours before they became ill, who were they with, where did they go, what did they do, how long were they there, all of those details. So we're really relying on the case to give us that information so that we can make appropriate recommendations to everyone else. And then we also speak to people that they say were close contacts. And sometimes what will happen is the case will remember something and call us back. Or when we speak to the contacts, they'll say, oh yeah, so Billy was also there, whatever. And so we follow up on all that as well.
From Jeff with WATE, in your conversations with UT, have you discussed the situation surrounding their sorority and fraternity houses? Can you determine if there are particular hotspots within the campus community?
We're working very closely with UT, and as you know, we don't speak specifically about any cases or clusters, but they have a really robust plan. And when we come back together and gather, we knew that there was some inherent risk of students coming back to campus and activities that they would participate in. I just want to remind any UT students that might be watching, you also need to observe the 5 core actions, whether you're having a party or whether you're in class. You need to observe them all the time.
All right, any other questions? Please go ahead and submit them into that chat feature now. All right, not seeing any other questions appear, so we will go ahead and log off for today. Thank you all for your time, and we will be back with you on Thursday at 12:30. Have a good rest of your day.